This morning at one of the CLL sessions, I presented the results of a phase 1/2 study combining a novel PI3K inhibitor with a novel anti-CD20 along with the BCL2 inhibitor venetoclax. So it was a 3-drug combination of Umbralisib, ublituximab, and venetoclax. The strategy being to use these 3 agents to achieve deeper remissions for CLL patients with relapsed disease using a shorter duration of therapy, which, while we have many new agents, is still an unmet need for this class of patients. So the phase 1 results essentially showed us that the recommended phase 2 doses were well tolerated at the typical doses and frequency that we would normally use. Overall, we administered 3 cycles of Umbralisib, ublituximab to debulk patients, then combined venetoclax and Umbralisib for 9 additional cycles, the total therapy being 12 cycles or just about 1 year. So again, safety-wise, the results suggested manageable myelosuppression, manageable GI toxicities, and importantly, no evidence of tumor lysis syndrome or laboratory tumor lysis. So all in all, patients seem to tolerate the treatment very well. Efficacy speaking, the goal was really to induce deep remissions with the shortest possible therapy. So over the 12 cycles, we monitored CTs along the way, and by the end of 3 cycles, the majority of the patients have responded. By the end of 7 cycles, all patients had achieved an objective response, and at the end of the 12 cycles, 9 patients have only finished the entire 1-year treatment plan so far, but of those 9 patients, 4 had achieved a complete response and 5 a partial response. Maybe one of the most important points in terms of efficacy was the MRD detectability rate. All 9 were undetectable in the peripheral blood, and 7 of the 9 were undetectable in the bone marrow. So putting it all together, it really does look like a manageable regimen that's not overly toxic, that only takes a year to give. The efficacy very early on, but looks very promising. So with this in mind, enrollment continues to this phase 1/2 study. We've expanded it to ensure that we are treating a sufficient number of patients that had been previously exposed to BTK inhibitors. We've also expanded it to investigate the regimen in Richter's transformation as well as mantle cell lymphoma. We used a flat dose of the antibody, ublituximab, 900 milligrams. In the phase 1 portion, we administered it 5 times over the first 3 cycles. The venetoclax dosing was standard 5-week ramp up to 400 milligrams. The Umbralisib dose is the agent that was explored in the phase 1. It was well tolerated at 600 milligrams and well tolerated at 800 milligrams. Ultimately leading us to conclude that the 800 milligram dose would be the recommended phase 2 dose, as it is in other studies. So we're really using the standard doses and frequency that have been used in other clinical trials. So acknowledging that it's very early on, I really think we're seeing pretty promising tolerability and efficacy. Again, acknowledging that we need to see the long-term outcomes, the progression-free survival. But having said that, we know venetoclax is already a standard of care in the relapse refractory setting and potentially the first-line setting. So I think there's a lot of potential for this 3-drug combination to build on what venetoclax has already taught us, that it can be a very efficacious treatment regimen using limited duration therapy. So I think in the short term, this really could change how we treat relapse refractory patients, and we're anxious to explore it in other areas further.